Well, the Men's Health Awareness 5K in Benton Harbor steps off this morning in downtown. Hosted by local men's health nonprofit Present Pillars, the walk run starts and ends at the Pillars Center located on West Main Street. Check-in is at 8:30. The event starts at 9. It is open to all with giveaways while supplies last. Proceeds from this will support men's physical and mental health awareness programs run by Present Pillars. And that brings us to this weekend's conversation. And I talked to a urologist at Corewell Health about men's health ahead of the 5K run walk. My first question was, what checkups or screenings should men be getting, and when should they start?
There are multiple things that we should look at. One is prostate cancer. That is a very common thing that men deal with when they're in their 50s, 60s, and 70s. And getting a PSA blood draw is a great first thing to do. And that is recommended to start when you're 55 through 70. But if you have a family history or if you're African American, we recommend you start when you're in your 40s. There's also cardiovascular screenings where you're looking at your cholesterol. We're looking at your blood glucose, your sugars. How is your overall health looking at? And that's where, talking to your primary care provider is very important to make sure all of those screenings get accomplished.
Similar to mental health, there can be a stigma surrounding urology issues in general. And so how can we as a community better support men who are dealing with those issues, whether it's also the stress that accompanies dealing with these issues and or the stigma surrounding said issues?
The primary issue is men struggle to just come in and talk to their physician about an issue that they're having. Sometimes they even struggle to talk to their family members. And that's where having, just an open dialogue and saying, hey, this is something that's been bothering me more recently, whether or not it's talking to your family first and getting the encouragement to go talk to your physician, that stigma is something that we continuously try to break down and say, it is okay for men to seek help, because we know that as men, we struggle to do that. As a urologist, I can talk about prostate cancer all day, but men's health is such a bigger part than just prostate cancer, right? It's mental health screening for depression. Is it cardiovascular disease, which is the #1 killer in men? Is it, again, psychiatric issues or diabetes, all of these issues, weight gain, obesity? And being honest with yourself is the first step. And then from there, talking to your family members, getting set up with a physician.
And why is it important for men to be honest with their doctor as well?
Well, it's difficult to diagnose something if you don't know exactly what the patient is asking them about, right? So if somebody isn't, giving the full truth or, hiding a couple of symptoms, it's difficult to kind of really nail down the primary issue. And that's where the open dialogue. And for me, I always just love to sit down and talk to my patients and say, hey, this is an open space, and how do we address things as we need to, and how can we walk together in this journey.
Our thanks to Dr. Tobert for his time.